we've got Dr. David Nicol, a consultant neurologist and spokesperson for the Doctors Association UK. And as a hospital doctor, I imagine he will have a slightly different perspective. Thank you very much for joining us, Dr. Nicol. What's the impact been on hospitals of the pressure that GP services are under? Because we know that when people struggle to get through to their GPs, if they really do need healthcare straight away or in the near future, they will tend to turn up at A&E, and then there's a knock-on effect all through those hospitals. What's your experience?
But I think there's been, I just caught the end of the last speaker. I mean, I think there's pressures on throughout the system, and frankly, I'm kind of fed up of the negative media coverage and pressure on GPs. This is a reflection of the pressures on the system, and actually all of us are working differently. I'm using video and phone in a way that I've never used before, and for the right patient it can be the right thing, but clearly if there's patients that need to be seen face to face, they will be seen face to face, as is the case in primary care.
But the trouble is they're not. The reason that the media is bashing doctors, as you probably perceive it, is that the everyday experience of patients trying to get through to their GP surgery is that they're being held back from doing so. I know myself, if I ring the GP surgery a second after 8 o'clock, I find myself number 28 in the queue. I then have to stay on the line for ages, and eventually I'm told there's no appointments left.
But I think that is a reflection on the pressures on the system. And, we have a government that promised 6,000 more GPs, and those numbers have gone down, and yet demands have gone up. And, thank goodness for GPs who've delivered a vast proportion of the vaccine programme. But it is a reflection that healthcare is under huge stress at both primary and secondary care. So I absolutely understand the pressures that patients feel under, but that's because of the pressures that we're under. And actually, I think a lot of credit needs to be due to primary care for the way they've shown flexibility and dealt with the system. I can think of that myself. I had a medical problem in May, which could have potentially been quite serious. I got triaged by my GP, saw a face-to-face examination, and yes, he did examine me, and got sorted, and I've had phone follow-up since. So it has to be for the right patient. I absolutely accept that there are incidences where patients clearly have come to harm, where they should be seen face-to-face. That's also true in secondary care as well.
Yes, I mean, you're a doctor, you know how to navigate the system, and the reality is that for those of us that are articulate and pushy, there's usually a way through all the barriers. It's the many others who don't necessarily have the time and the resources and the contacts that lose out.
Absolutely, but the targets that are being used don't help. For example, yesterday I had a phone consult with a patient who's deaf, who has Parkinson's. Okay, that was a complete waste of time. That's
absolutely ridiculous.
Of the system.
Yeah.
And that patient will be seen face to face. But equally, I also do manage some very rare diseases. I saw a patient last week. I work in Birmingham from Exeter. And actually was able to do a very effective consult by video, and that saved her, being stuck on the M5 for 3 hours. And
indeed.
In fact, think about that.
But something's not working, is it?
All journeys in England.
Something isn't working in it. I'm sorry to interrupt you, but something's not working, is it? If you are putting your time aside for a patient who's deaf, to have an over-the-phone consultation, it's clearly going to be a farce. It's going to be very frustrating for the patient, very frustrating for you. A part of the system failed there. What happened at the triage stage? Why were you ever put in that position? And more importantly, why was the patient let down in that way?
Well, that's a reflection that the whole system is under stress and pressure. I'm afraid, some of the stuff has been utter garbage that's come out of the media, and actually, you're going to see increasing retirements, not just in GPs but also hospital care, which is going to make those of us who are left under even more pressure, basically. And what Sajid Javid has singularly failed to do is deal with the resource issue in terms of numbers of staff. He's the man that, I stood against him in the election, that promised more GPs, and actually the numbers are going down.
You're absolutely right. Of course, the more pressure there is on those that remain, the less hours they want to work and the more likely they are to leave. What do you think will happen to the NHS if GP services don't dramatically improve? I mean, I've studied this whole subject quite carefully. I really think that it's existential in primary care. And, you know, GP services are the gateway to the rest of the NHS. Where do you see this going?
I can't work as a neurologist without successful primary care, and I'm extremely grateful for all my colleagues in primary care. But frankly, I am fed up with the pressures under, and you know, we're still in this pandemic. And sorry, Isabel, you know, I don't, you know, we're still in this. We've essentially got bored of the pandemic. People need to wear a mask. It's not a muzzle, as you've described it.
Well, there's very little evidence that masks actually work, so my criticism is focused on what evidence there is, not on a political approach.
There's plenty of evidence. Okay, plenty
I
of
would love
evidence.
to. We don't have time, unfortunately, to discuss the studies. I've looked at them. There is precious little evidence, so I'm sorry, we're going to disagree on that.
Well, never worry about criticism from somebody you wouldn't take advice from, as Chris Whitty said yesterday.
Thank you very much, Dr. David Nicholl, a consultant neurologist and spokesperson for the Doctors Association UK.